be part of this summit. My name is David Lakey. I'm currently the Vice Chancellor for Health Affairs and the Chief Medical Officer of the University of Texas System, and want to welcome you to day 2 of our 6th annual conference, the Texas Collaborative for Healthy Mothers and Babies Annual Summit, with our theme being to address health disparities through quality improvement efforts. I hope you benefited as much as I did yesterday from the conference and the presenters, and were challenged like I was related to our work to improve the health of mothers and babies in the state of Texas. And again, I want to thank you for taking time out of what I know is an incredibly busy schedule as you are taking care of a variety of issues today to be part of this discussion and working with us to improve the lives of mothers and babies in our state. So yesterday we started off hearing from a personal point of view from 4 individuals from 3 families of why this is so important. And again, I was challenged, and I know you were challenged by the bravery of these individuals in sharing their stories of how things didn't always go right for them and the opportunities to improve how we take care and work with them to improve their lives and the care that they receive. We also took a look at the data, and we're confronted by the data and the facts that we're not doing as well as we need to, especially in the area of disparities, with infant mortality rates being twice as high for African-American babies as they are for Caucasian babies in our state. We were then challenged to incorporate a health equity lens into our quality improvement collaborative initiatives to address the racial and ethnic disparities that we're seeing, and then spent time in 2 specific work groups, one looking at maternal hypertension, another one look at neonatal thermal regulation and concrete things that we can do to improve the care, again, of moms and babies in our state. So let's go to the next slide. And as we start, I want to, again, thank you for being here and give you some background information related to the summit as a whole before we get into today's speakers. I want to let you know that the summit is being recorded, that all conference documents, the slides, the recordings will be made available to you after the summit. And at the end of the day, to encourage you to complete an evaluation survey. The link will be shared in the chat and via email following this meeting. You can go to the next slide. I'm going to spend a little bit of time going through continuing education. We've worked hard to make sure that continuing education is available for a variety of professions after attending this event. These hours are being provided by the Texas Department of State Health Services through their continuing education service. And I'm going to go through the different groups that we've been able to provide these CE credits for. The first being the medical education. There are continuing medical education credits at 18.75 credit hours that are made available category 1 through this initiative, again, through partnership with the Texas Department of State Health Services. On our next slide, we have information related to nurses and social workers. Again, 18.75 contact hours and for both nurses and for social workers, both through the Department of State Health Services. On our next slide, again, for those individuals that need certified health education specialists, continuing education credits, they are available, again, at 18.75 total entry level category 1 hours. And for certified individuals that are certified in public health, again, approved at the 18.75 credit hour level, again, through the Department of State Health Services. Next slide. For those individuals that are licensed professional counselors, again, continuing education credits are available, again, at 18.75 contact hours. And if you need just a certificate of attendance, again, up to 18.75 credit hours are available. And again, for all these professions, we ask that you only ask for the credit hours for the hours that you attended these conference and presentations over the last several days. We can go to the next slide, please. I need to read this verbatim in order to make sure that we are doing exactly what we're supposed to do. So this event received no commercial support, The following planning committee members and speakers for this event have disclosed financial interests. Nicole Purnell receives grants and research support from Merck for Mothers. Maha Madarik owns shares and is a co-founder of Embodied Inc. And no other planning committee members or speakers have financial interests to disclose. We go to the next slide. To receive those continuing education credits, you must attend the full session. If you're requesting the continuing education credits, you must complete the continuing education evaluation by the 17th of this month, and then that will be emailed to you later this afternoon. You can also find the evaluation on our website, and you have the website there at on this slide, and that link is also being shared in our chat box. Next slide. Again, I would encourage individuals to let people know that what's going on today. I was encouraged by the comments in the chat box yesterday, and it would ask you to put your comments in the chat box, but also to use social media. We'll go through and give you a little bit of detail related to how the social media that's being used for this event. But again, we want to hear from you. We want others to hear from you that we are dedicated to improving the lives of mothers and babies in our state. We can go to the next slide. I want to again thank our sponsors that make this possible. At the gold level, we have St. David's Foundation, ACOG District 11, Dell Children's Health Plan, Driscoll Health Plan, the March of Dimes, TTAF, which is the Texas EMS Trauma and Acute Care Foundation, and the Texas Perinatal Services, and the Texas Hospital Association. And at the silver level, the Texas Academy of Family Physicians. Again, thank all of them for their dedication to this work and providing the financial resources that are needed in order to make this happen. We can go to the next slide. As I noted, we want to encourage you to use social media in order to let people know what you're learning today and our dedication to move these issues forward and to address these really important issues. Use hashtag TCHMB 2021. You have the Twitter handle there at Texas PQC, the Twitter handle for our Texas Collaborative for Healthy Mothers and Babies. And then you see the Facebook address for our Texas Collaborative for Healthy Mothers and Babies. Next slide. I also want to, again, encourage you to not only attend today, but plan to attend next year. And so go ahead and mark on your calendars that February 16th through the 18th is when the 2022 summit will occur. We're still obviously in the planning stages. We're looking through whether how much of that will be in person versus how much of it will be virtual. But want you to go ahead and dedicate those dates to be part of that continuing education on improving the lives of moms and babes in the state of Texas. Next slide. So with that, again, it's my privilege to introduce Dr. Catherine Epps, the chair of the Texas Collaborative for Healthy Mothers and Babies, who will be leading us through this morning, along with Dr. Savani from UT Southwestern. And Dr. Epps, let me hand over the virtual podium to you. Thank you.
Thank you, Dr. Lakey, and thank you so much for everything that you do. So as Dr. Lakey already summarized, we had a great day yesterday. We heard from a number of speakers, including Dr. Barfield, about the impact of racial and ethnic health disparities. We heard from our patient and family panel about how we are not listening to our patients and families and why that has such a tremendous impact and how we need to do better. We heard about our own Texas data on maternal and birth outcomes. And then Dr. Persley discussed our health equity lens into quality improvement. So hopefully that has left us with not only seeing the scope of the problem and the work in front of us, but with some tools moving forward. And then finally, the day ended with our two concurrent sessions, one on the newborn admission temperature and the other on maternal morbidity and mortality related to hypertension. So just as Dr. Lakey said, we are challenged to carry that work going forward and how much there is in front of us. But I also want to acknowledge this is a group of folks who signed up for a health equity themed summit, right? So we are a group that acknowledges and wants to do more going forward. But we have a lot of work to do within our communities and our hospitals for the people who haven't signed up for this summit. And hopefully we're going to leave with more actionable tools. So for today's agenda, a couple of highlights before we transition. We're going to start with talking about the role of the March of Dimes with health equity. Megan Young's going to discuss the Healthy Texas Women Plus program for our state. We'll move into lessons learned during the COVID pandemic, both hearing from Dr. Shuford about vaccine distribution and from a panel about the impact on perinatal care. And then finally, we'll examine the needs and opportunities to address perinatal mental illness. So with that, it's my great pleasure to get to introduce Dr. Rashman Savani. So he's the vice chair and the chair-elect for the Texas Collaborative for Healthy Moms and Babies. He's a professor and a William Buchanan Chair of Pediatrics at the University of Texas Southwestern in Dallas. And in that role, he leads a large academic division focused on neonatal, perinatal medicine, providing care to 20,000 deliveries and 250 NICU beds per year in 4 different hospital systems in Dallas. He's published over 80 peer-reviewed papers, and he's on the DFW board for the March of Dimes. And with that, I'll turn it over to you, Dr. Savani.
Thank you, Dr. Epps. It's a real joy, and thank you for that kind introduction. I think that this is an exciting time for Texas, and Texas has had many initiatives that have pushed for the improvement of the health of mothers and babies, and those have been legislatively mandated. And the effect of those initiatives was really good work that was being done, and it resulted in the Perinatal Advisory Council and the writing of the rules of the maternal and neonatal designation process. It was very clear to us that the establishment of the perinatal care regions, 22 of them in our state, gave us an opportunity to unify the state in terms of trying to do what is best for moms and babies in a united way. And the birth of the RAC, Regional Advisory Council Perinatal Care Region Alliance, which unified the 22 different regions in Texas, was a good thing. And I'm very excited and happy that in the last year or year and a half, we've worked extremely hard to try and put the RAC PCR Alliance embedded together with the Texas Collaborative for Healthy Mothers and Babies so that we could all speak with one voice. And the effect of this is that a perinatal care quality collaborative for our state is now connected to every single hospital in the state. And so I think that this will afford us really an enormous opportunity to try and up the game for quality for mothers and babies. And we had an exciting first day, as Dr. Epps just pointed out. We look forward to this wonderful day for great speakers and panel sessions. But I'm going to turn it over to Dr. Patrick Ramsey, who is going to be the moderator for the next sessions. Dr. Ramsey.